If you want to reflect the quality of care you're providing and have a positive impact on the quality metrics, then this video is for you. Hi everyone, welcome to my CDI channel. I've been working as a CDI specialist for over 10 years, and I will share with you what I have learned and how you can positively impact your quality metrics. I'll start by talking to you about what is CDI and why documentation is so important. CDI stands for Clinical Documentation Integrity, and CDI specialists review charts to ensure that the provider documentation accurately reflects patient condition and severity of illness. Why is documentation important? Because it reflects quality of care provided by the hospital and physicians and impacts quality metrics. Let's say you have two different patients both being treated for hypertension. One a 40-year-old patient, the other a 79-year-old patient. The only way to capture the severity of illness differences in those two patients is through documentation. In this video, I'm just gonna focus on assessment and plan portion of the note. I'll link a video below, a great video by a doctor who explained how to document in your progress note all the components that should be included in a great progress note. So check that out to get the whole picture. Here are a few points you should be paying attention to when you're documenting on your patients. The first important point is to give an exact description of your patient's presenting symptoms or chief complaints. You can document something like 79-year-old patient with past medical history of CHF, COPD, CKD, admitted with shortness of breath. The next important point is to document diagnosis related to chief complaints. For example, shortness of breath due to acute on chronic systolic heart failure. Let's say you have another patient who came in with shortness of breath, and the only explanation you have for their shortness of breath is lung cancer. You should document something like shortness of breath related to lung cancer. Every single time you document diagnosis related to chief complaints, you should follow that with assessment, evaluation, and treatment and plan. For example, shortness of breath due to acute on chronic systolic heart failure, BNP of 900, echo EF of 30%, improving on Lasix BID, fluid restriction, and heart healthy diet. That gives a complete picture of what's going on with the patient, your diagnostics, and the treatment and plan. The next important point I want to talk about is always document diagnoses related to signs and symptoms if known. Syncope is a common admitting diagnosis, right? And if you can't find a reason for the syncope, then you should document that. Syncope, etiology unknown or unclear. If you know the reason for their syncope, then you should document something like, for example, syncope related to dehydration, syncope related to arrhythmia. Yes, never leave signs and symptoms without explanation. The next important point is to document electrolyte imbalances and treatment provided. Do not document imbalances repeated. You should be writing out each electrolyte imbalance and the treatment provided. For example, hypokalemia, K 3.1, repleted. It can be simple like that, but it should be written out, each electrolyte imbalance. If you feel that your patient is malnourished, you should document that. You should also place a dietitian consultation order so the patient can get the necessary supplementation that they need. You should also specify the type or degree of malnutrition, and that information can be found in the dietitian's assessment notes. The next important point is document any and all chronic conditions. Sometimes you might feel that you are not necessarily treating all of their comorbid conditions during that hospital stay, but you still should document it to give a complete picture of your patient and to reflect the true severity of illness in your patients. You should be documenting any and all comorbid conditions. Again, if you feel that you're not treating it, you can document under the heading of chronic conditions. For example, CHF, specify the type always. If COPD stable, if the patient has lung cancer with mets to liver and brain, specify that. Each of those metastatic sites, the cancer sites, can be captured as a separate comorbid condition, and it'll reflect the severity of illness in your patient. The next important point I want to talk about is DC summary. Make sure your DC summary is concise and complete. If there are any loose ends, you want to tie that up. If there are signs and symptoms documented without a diagnosis, to clear that up. Make sure you are documenting also the diagnosis and treatment and plan you are providing or you have provided. If you are unclear, then you should document that. Etiology unclear or unknown. If you pay attention to all these important points when you're documenting on every single one of your patients, it'll make a huge difference in your quality metrics. I hope you find this video helpful. Leave a comment below. Don't forget to like, share, and subscribe. That's it for today. Take care. Goodbye.